Bird flu has spread between farm mammals in at least 5 states this year, and health agencies note pets like cats and dogs may be susceptible if they're exposed to infected animals, though transmission to humans is unlikely. The Department of Agriculture announced bird flu was detected in dairy herds in Texas and Kansas on March 25. The agency later discovered dairy herds in Michigan, New Mexico and Idaho were also infected. Minnesota also reported a case of bird flu in a goat on March 20, which is the first case of infection in a domestic ruminant in the U.S., referring to many common grazing mammals in the U.S., including domestic cattle, according to the AVMA. On April 1, Texas officials announced the second known case of a type of bird flu called H5N1 in a person in the U.S., which was spread from exposure to cattle. The first occurred in 2022 when a person in Colorado contracted the disease from infected poultry. This case does not change the risk for the general public, which remains low, according to the Texas Department of State Health Services announcement. The patient reported eye redness as their only symptom, and is being treated with antiviral medication, the CDC reports. Though human infection is rare, there have been 887 reported cases between January 2003 and February 2024 in 23 countries, according to the World Health Organization. The virus can be extremely dangerous for humans who are infected, as 52% of these cases ended in death. A veterinarian in New York City was infected with H5N1, a type of bird flu virus, after caring for infected cats admitted into an animal shelter in November 2016, according to a study published in Clinical Infectious Disease. The cat died a few days later, and further testing discovered the virus spread throughout the facility to several other shelter cats, though other animals like dogs weren't infected. No one who came into contact with these cats, including the 165 volunteers and employees, and over 180 adopters, were suspected of having the illness, except for the visiting veterinarian. This person had prolonged exposure without face protections with infected cats and their secretions. The veterinarian had a mild illness, which included a sore throat, cough and muscle pain, though they were treated and cured with medication without hospitalization. The Food and Drug Administration has approved a few bird flu vaccines for humans. The U.S. has a small stockpile of vaccines for 2 bird flu viruses, H5N1 and H7N9, but it wouldn't be enough to vaccinate all Americans if an outbreak were to happen among humans. If an outbreak among humans does occur, the government plans to mass-produce vaccines, which can take at least 6 months to make enough for the entire population. Sequirs, the maker of one of the approved vaccines, expects to have 150 million vaccines ready within 6 months of an announcement of a bird flu pandemic.